This is Boomer Life on CL 650.
With you on my mind. With you on my mind.
Welcome back to Boomer Life as we reach back to the 50s with you on my mind. A little Nat King Cole music. Sterling Fox in studio with Philippe Silvestre and Sonia Dale from Neurokinetics Clinic in Vancouver. And we're joined on the line by Laurel Hancock, another, well, we can say Neurokinetics success story. Laurel, thanks for joining us. Hello.
Hi, how are you doing?
Well, I'm fine, thank you. Yeah, it's good to have you on the program. Tell us a little bit about yourself. You're a professional person. What do you do for a living, Laurel?
I work in marketing at a nonprofit currently.
Oh, okay. What brought you to Dr. Philippe and the Neurokinetics Clinic, and how long ago did you go there?
A friend of mine actually put me in touch with Dr. Silvestre over 3 years ago. And it was just fate that I found him at the timing that I found him. He was a huge help in my healing journey. So it was over 3 years ago, and it was a friend of mine that directed me to him.
Okay, now I need to know about the healing journey. Healing from what, Laurel? What happened?
Well, I was an active soccer player my whole life, and over 3 years ago, I just started developing symptoms that I couldn't figure out, didn't understand the cause of, including terrible headaches.
Mm-hmm.
And so this was all happening while I was working. Probably the worst headaches I've ever had in my entire life. And that lasted for a couple months before I found Philippe. And just a lot of, weird nerve dysfunction, brain fog, weird muscle-y stuff, and it was just a matter of time. I was being bounced around in the medical system, and, it was kind of traumatic, actually, and didn't really know where to go, but luckily I found them.
Well, as we're about to find in June again, we're going to be reminded many times over in June when the Women's World Cup of Soccer comes to Canada, we're going to be reminded, Laurel, in spades, that women's soccer is not a non-contact sport. There's an awful lot of contact that goes on, and a lot of women get injured, including you.
Yes, apparently women store their concussions a lot longer, and it takes them a lot longer to heal from any kind of brain injuries. And they're thinking about taking heading of soccer balls out of women's soccer altogether. So.
Is that right?
Yeah.
I'd heard about that in the context of children's soccer in the past, but not the women's aspect of the game. Interesting development. So what specifically happened to you, Laurel, that took you to a doctor in the first place? Was it an injury on the playing field? Did you get an elbow in the head and you saw red and that was the end of it? Did you get knocked out?
You know what? I think the verdict, the overall consensus is too many injuries and too many balls to the head. So it was just like a compounding thing of, years and years of injuring myself because it was pretty competitive soccer.
Oh, I'll bet.
Yeah.
And so you said you bounced around the medical system a little bit. Explain that, please. And it's something that I'm sure we can all relate to, but tell us your story.
Well, I kind of just went on this tear trying to get rid of all these symptoms, not really knowing what was causing them. So I, visited the medical doctors, and, I visited a neurologist, and I really didn't have much help. They were kind of not helpful at all, actually. So you kind of have to explore other options at that point.
How did you find out about Neurokinetics?
Well, they are associated with the charity that I now work for, and it was kind of like I'm so surprised I hadn't heard of them before, but it ended up being a fellow colleague of ours that put us in touch.
So another one of those personal referrals, Sonia, that you're talking about.
Yeah.
And it's word of mouth. And what we're trying to do is extend the word of mouth just a little bit further here on Boomer Life by having people like Laurel show up, especially Dr. Philippe, and to tell the story from the patient's perspective about finding you and getting better. So, Laurel, when you finally found Dr. Silvestre and went to Neurokinetics, what happened to you?
I spent about 3 months there, and initially it was so reassuring to find Philippe, and I just feel like he spent the time with me for the initial couple weeks I was there, just trying to educate me and let me know what's actually going on with my brain and why it's doing these things. And he would spend hours with me, honestly, out of his own personal time, so I thank him for that. And honestly, at that time of my life, it was really when I needed somebody to explain things to me, because you're kind of in the dark.
Well, and isn't that spooky, Laurel? I mean, when you know something's wrong, you're just off your game. You're absolutely certain that there's something wrong. You start seeing medical professionals, and you get no satisfaction. You don't even get to know what's wrong, but you know something's still wrong.
Right.
And finally, you sit down across from a person who goes, "Oh, I know what you have." And then, Philip, I guess you would just start going through the list. Do you experience this? Has this happened to you? And so on. And that's all part of those 3 assessment meetings, correct?
Correct.
So in Laurel's case, how long did it take you to develop an understanding of her circumstances?
Well, it took a similar amount of sessions that were mentioned in the previous segment of this show. But the methodology used was different, as every patient's experience is quasi-unique.
Okay. And I suppose, Laurel, though, in the absence of information and a growing degree of frustration in your life, the information, the knowledge, first and foremost, that, well, I understand what's going on, and here's what it is, and here's what we can do for you. What an enormous relief that must have been all by itself.
Yeah, it was huge, actually.
And how long did it take from getting that important knowledge to developing and entering into a program of therapy where you actually began to aggressively get better?
Well, we started pretty quickly after I was assessed at the clinic, so it was right away.
And how long did your particular program last, Laurel, and how many occasions per week were you required to come to the clinic?
I was there for 3 months, and I was there on average maybe 2 to 3 times a week.
Okay. And during that time, over the 3-month period, did the frequency stay the same, or as you started to get a little better, were the occasions reduced?
I think the occasions were reduced, depending on the symptom. For example, a lot of things like, for example, the anxiety went down a lot. I feel now, looking back in hindsight, and just the mobility and some of the soft tissue injuries and some of those things, like some of the pain diminished, definitely the headaches. So, yeah.
And was this...
What I got there?
I was just curious, Philip, when you sit down with a patient like this and you know what's going on and you ask all the questions and you do extensive intake analysis and assessment, and once you develop that program for that individual, how closely does that person need to follow the program after finishing the clinical part with you on a weekly or daily basis? Are there post-clinic exercises or activities to continue to repeat to ensure brain health?
No.
Oh.
No, not at the beginning anyway. The reason is the brain functionality after such a trauma in general is very diminished and decreased, and the brain is actually busier in trying to compensate what is no longer working well.
Mm-hmm.
It is a live engine, if I may say, and a lot of processing will be developed and spun up a little bit, enhanced to compensate what is missing. So that explains the fatigue, physical fatigue, explains the cognitive fatigue, and explains the emotional fatigue.
Right. Right. And I suppose, Laurel, in your case, as would be the case with anyone who's experiencing and knows with certainty that something's wrong, but unable to identify it and unable to have medical practitioners assist in identifying it, gets a little scary after a while, doesn't it? It's beyond weird. It starts to get scary.
Oh, it was hugely traumatizing. I'm not going to lie. 5 months of just unknowing and, having scans and everything coming back negative, like you just don't even imagine that something like this could happen to you, but it can. So
And in your case, I assume you started playing soccer as a little girl, right?
Yeah, I was 8 when I started.
Okay, and so do you still play?
Heck no.
Enough
Nope.
already. But you
I retired.
a very active, very athletic, a very competitive person who played organized soccer for decades.
Right.
And so this trauma, Dr. Philippe, that Laurel came to you with was basically an accumulation of years of small traumatic events.
True. And there's a name for this. There's a name. As far as it relates to the concussive phenomenon, we call that complex chronic post-concussion syndrome.
Okay.
So there's a name. There's a larger entity which includes that along other modalities, which is called the postural deficiency syndrome. And this paradigm is totally unknown in North America.
So Laurel, when you found out you had traumatic post-concussion syndrome, even though you perhaps didn't understand what it meant, and nonetheless, you had an identification. Somebody went, this is what's wrong.
Mm-hmm. Yep. I needed that.
Well, wouldn't we all? I suppose it's the uncertainty. And Dr. Philippe, you keep coming back to this. Information is so important to the brain-injured person. They have to understand what's wrong before they can begin to get better.
Understanding is everything.
Right. How you doing these days, Laurel?
I'm back at work. I've been back at work for about a year and a half now. I'm definitely not playing soccer.
Okay.
I'd say I'm 70% there, but I know that the brain takes time to heal, and I'm doing everything I can on the side to help that along.
I would like to complete what I just said. Understanding is everything, but is not sufficient.
Right.
To heal.
Oh, okay. So in Laurel's case, she says she feels about maybe 70% completely recovered, and understanding that there is a time requirement here. Is it possible for a brain-injured person like Laurel to achieve 100% recovery?
Potentially, yes. In a sense, there is no limiting damage that would prevent full recovery.
Okay. So but then it's a process, isn't it?
It is a process,
okay.
Yeah. Because even damaged tissue may, through time, repair and heal.
Okay. Yeah. Laurel, I'm delighted to hear that you're okay and feeling well and have benefited as hugely as you clearly have from Neurokinetics.
Yeah, definitely.
Well, thank you for joining us. It's really nice to have you on the radio. And say goodbye to Sonia and Philippe here if you want.
Thank you, Laurel. Bye.
Thank you for sharing, Laurel.
All right. There's Laurel, another success story from Neurokinetics. We'll take a quick break here, and we'll talk a little bit more about concussions and treatment when we come back on BoomerLife.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.